She saved animals for 15 years. Same small-town veterinary clinic. Same gentle touch with every creature that needed help. Pet owners saw a caring doctor who worked miracles with sick animals. Until one winter night when a dying dog needed surgery that should have been impossible in a rural clinic. That's when Dr. Emma Hayes did something extraordinary, using techniques that seemed to come from a battlefield, not a veterinary school. The quiet woman who healed pets had once been Staff Sergeant Hayes, Army combat medic, who had saved more human lives under fire than anyone wanted to count. Welcome to Silent Hero Stories. Before we start this incredible story, tell me in the comments what city you are watching from today. If you believe healing hands come in many forms, hit that subscribe button. These stories matter. Dr. Emma Hayes unlocked the doors of Millfield Veterinary Clinic every morning at 7 a.m. Small town, population 3,200. Same routine for 15 years. Same quiet dedication to every animal that needed care. Emma was 52 years old. Auburn hair usually in a practical ponytail. Gentle green eyes that seemed to understand animal pain better than most people understood human emotions. She wore scrubs or simple clothing. Always practical, never fancy. Millfield Veterinary Clinic was everything a small-town vet office should be. Clean, organized, filled with the sounds of healing. Emma treated everything from farm animals to family pets. She never turned away an animal because the owner couldn't pay. Dr. Hayes, Buddy's been limping for 3 days. Let's take a look, Mrs. Peterson. Buddy, you're gonna feel better soon. Emma's touch was legendary in Millfield. Animals that were terrified of other vets became calm with her. Dogs stopped shaking. Cats stopped hissing. Horses let her examine them without restraint. Doc, how do you do that? Animals sense intention. They know when someone wants to help. You have a gift. Experience. Lots of experience. But Emma had unusual qualities for a small-town vet. Her diagnostic skills were exceptional. She could assess trauma and prioritize treatment like someone with advanced emergency training. Her surgical techniques were precise, efficient, almost military in their organization. And her knowledge of trauma medicine went far beyond veterinary school. Dr. Hayes, how do you know so much about treating traumatic injuries? Different cases require different knowledge, but you handle trauma like an emergency room doctor. Good medicine is good medicine. Emma's clinic had equipment that seemed advanced for a rural practice. Some instruments looked more like human surgical tools. Her emergency protocols were detailed, systematic, professional. Most mysteriously, Emma never talked about her past. The townspeople knew she'd moved to Millfield 15 years ago, opened the clinic, and dedicated herself to animal care. But nobody knew where she'd come from or what she'd done before. Dr. Hayes, where did you practice before Millfield? Different places, different work. Were you always a veterinarian? I've always been interested in healing. Sometimes, late at night, people saw lights in the clinic. Emma working on emergency cases, often for free. Farmers brought injured livestock. Families brought pets hurt in accidents. Emma never refused, never complained about the hour. Tuesday morning, Emma's new veterinary assistant started work. Tyler Martinez, 24 years old, fresh from veterinary technician school, eager to learn from the legendary Dr. Hayes. Tyler, welcome to Millfield Clinic. Thank you, Dr. Hayes. I'm excited to work with you. Good. Let's see what you know. Tyler was smart, dedicated, but inexperienced. Emma began teaching him not just veterinary techniques, but approaches to animal care that seemed different. Tyler, when you assess an injured animal, what do you look for first? The obvious injury? No, you assess the whole animal. Breathing, circulation, neurological response. Then you prioritize treatment. That sounds like triage. Smart observation. Emma's teaching methods were systematic, almost military in structure. She taught Tyler to work under pressure, to make quick decisions, to organize equipment for maximum efficiency. Dr. Hayes, you teach like you've worked in emergency situations. All veterinary work is emergency work to the animal. But your approach is so structured. Structure saves lives. Tyler noticed Emma's unusual skills. Her suturing techniques were faster and more precise than what he'd learned in school. Her knowledge of pharmacology included drugs that weren't commonly used in veterinary practice. Dr. Hayes, how do you know about these medications? Cross-training. Sometimes human and veterinary medicine overlap. Did you work with human patients? I've worked with different patients. Tyler also noticed Emma's physical condition. She was 52 but moved like someone much younger. Her hands were steady under pressure. Hayes, you handle stress really well. Experience teaches you to stay calm. What kind of experience? The kind that matters when lives are at stake. One afternoon, Tyler found Emma in the supply room, organizing surgical instruments with precision that seemed military. Dr. Hayes, you organize everything like you're preparing for combat. Emma paused. Good organization prevents mistakes. But this looks like battlefield preparation. Preparation is preparation, Tyler. Over the following weeks, Tyler observed more unusual aspects of Emma's practice. Her knowledge extended far beyond veterinary medicine. When treating a dog with internal bleeding, Emma used techniques that seemed designed for human trauma surgery. Her assessment was rapid, professional, like someone with extensive emergency experience. Dr. Hayes, where did you learn trauma surgery? Different training programs, veterinary programs, among others. Emma's diagnostic abilities were exceptional. She could identify injuries and conditions that other vets missed. Her treatment protocols were advanced, sophisticated. Dr. Hayes, you diagnosed that internal injury instantly. Pattern recognition. You see enough cases, you recognize the signs. How many trauma cases have you seen? More than I'd like to remember. Tyler also noticed Emma's emotional responses to certain cases. When treating animals with wounds that looked like shrapnel damage, Emma's demeanor changed. More intense, more focused, like someone reliving difficult memories. Dr. Hayes, are you okay? I'm fine. Let's focus on the patient. You seem affected by these injuries. All injuries affect me. That's why we do this work. One evening, Tyler was staying late to help with inventory when he overheard Emma on the phone. She was speaking in medical terminology, but not veterinary language. Yes, the patient presented with multiple penetrating wounds, hemorrhagic shock, emergency thoracotomy. We got him stable. Tyler listened carefully. Emma was describing human trauma procedures, not veterinary ones. Dr. Hayes, who were you talking to? Medical colleague. Consulting on a case. Human medical colleague. Medicine is medicine, Tyler. The most revealing incident happened when a farmer brought in a horse with a severe leg injury. Emma assessed the wound and immediately said, "This looks like an IED blast pattern." Dr. Hayes, what's an IED? Emma caught herself. Improvised explosive device. Sometimes farm equipment creates similar injury patterns. How do you know about IEDs? Reading. Medical journals cover all types of trauma, but Tyler knew medical journals didn't teach pattern recognition for explosive injuries. That knowledge came from experience. Saturday night, 11:30 p.m. Emma was at home when her emergency phone rang. Tyler was calling from the clinic. Dr. Hayes, we have an emergency. Car accident. Golden retriever, massive trauma. Emma arrived at the clinic in minutes. The dog, named Max, was barely alive. Multiple injuries, internal bleeding, broken ribs, possible organ damage. Tyler, what's the assessment? It's bad, Dr. Hayes, really bad. Maybe we don't give up. Prep for emergency surgery. Emma examined Max quickly but thoroughly. Her assessment was rapid, professional, like someone trained for battlefield medicine. Penetrating abdominal wound, probable liver laceration, possible splenic rupture, definite pneumothorax. We need to operate immediately. Dr. Hayes, we don't have the equipment for that kind of surgery. We have what we need, trust me. Emma began transforming the clinic into something resembling a field hospital. She organized instruments, prepared medications, set up monitoring equipment with military precision. Tyler, I need you to assist exactly as I direct. No questions, just follow my lead. Dr. Hayes, this seems beyond. Tyler, this dog is going to live. Are you with me? Emma began the surgery using techniques that Tyler had never seen. Her movements were precise, confident, like someone who had performed trauma surgery under the worst possible conditions. She opened Max's abdomen with surgical techniques that seemed designed for human patients. Her approach to internal bleeding control was advanced, sophisticated. Dr. Hayes, where did you learn to do this? Focus on the patient, Tyler. Emma repaired internal damage, using procedures that shouldn't have been possible in a veterinary clinic. Her suturing techniques were flawless. Her crisis management was professional. 3 hours later, Max was stable, breathing normally, vital signs strong. Dr. Hayes, how did you do that? Experience. What kind of experience? The kind that saves lives. Tyler couldn't stop thinking about the surgery. Emma had performed procedures that were beyond veterinary training. She had worked like a combat surgeon. The next morning, Tyler confronted Emma directly. Dr. Hayes, I need to ask you something. What's that, Tyler? Last night wasn't veterinary surgery. That was trauma surgery. Human trauma surgery adapted for animals. Emma was quiet for a long moment. Tyler, what do you think you know? I think you were a human doctor before you became a veterinarian. Close, but not exactly. Emma sat down, looked at Tyler seriously. I was a medic. Army combat medic. 15 years active duty. A medic. Staff Sergeant Emma Hayes. 82nd Airborne Division. Combat medic. Tyler's eyes widened. You served in combat. Iraq. Afghanistan. 3 deployments. Field hospitals. Forward operating bases. Battlefield medicine. Dr. Hayes, how many lives did you save? I don't count. But it was my job to bring soldiers home alive. Emma explained her background. High school to Army enlistment. Advanced medical training. Deployment to combat zones where she treated traumatic injuries under fire. Tyler, battlefield medicine teaches you to work with limited resources, under extreme pressure, with lives hanging in the balance. Is that how you knew how to save Max? A traumatic injury is a traumatic injury. Human or animal, the principles are the same. Why did you become a veterinarian? Because after 15 years of war, I wanted to heal instead of just repairing damage. But you were saving lives. I was. But in war, you're always treating injuries caused by violence. Here, I treat injuries caused by accidents, illness, age, natural things. Tyler understood now. Emma hadn't abandoned medicine. She had transformed it. Dr. Hayes, do people in town know? Some suspect. Nobody asks directly. Why don't you tell them? Because they don't need to know who I was. They need to know who I am. Despite Emma's preference for privacy, word began spreading through Millfield. The veterinarian was a combat veteran, a decorated medic who had saved lives in war zones. But instead of treating her differently, people treated her better. Not because she was famous, but because they understood her dedication to healing. Mrs. Peterson, whose dog Buddy Emma had treated, approached her at the grocery store. Dr. Hayes, I heard about your military service. Mrs. Peterson, I hope that doesn't change anything. It changes everything. Now I understand why you're so good at what you do. Farmers began sharing stories. Emma had saved livestock that other vets said couldn't be saved. Her techniques were different, more advanced, more successful. Doc, you operate like you've seen everything. I've seen enough to know that every life is worth fighting for. Tyler became Emma's advocate in town. When people asked about her background, he explained carefully. Dr. Hayes served our country for 15 years. Now she serves our animals. Same mission, different patients. Other veterinarians in the region began requesting consultations with Emma. Her reputation for handling impossible cases was growing. Dr. Hayes, how do you approach cases that seem hopeless? I don't believe in hopeless. I believe in doing everything possible. Where did you learn that attitude? In places where giving up meant soldiers didn't come home. Emma started teaching advanced trauma techniques to other veterinary professionals. Not military medicine, but trauma principles adapted for animal care. Dr. Hayes, will you teach us emergency surgical techniques? I can teach you to save lives under pressure. That's what matters. Emma's routine didn't change after her background became known. Same 7 a.m. start times. Same dedication to every animal. Same gentle touch that calmed frightened creatures. The difference was deeper understanding. When Emma worked late on emergency cases, people knew why. When she refused payment from struggling families, people understood her values. Dr. Hayes, why don't you charge more for emergency surgery? Because healing shouldn't depend on ability to pay. That's not very businesslike. I'm not in this for business. I'm in this for the mission. Tyler continued learning from Emma, but now he understood he was learning from someone with extraordinary experience. Dr. Hayes, teach me to handle trauma like you do. Trauma response is about staying calm, thinking clearly, acting decisively. How do you stay calm? Training, experience, and remembering that panic helps no one. Emma's clinic became a teaching center for advanced veterinary techniques. Students came from veterinary schools to observe her methods. Dr. Hayes, your techniques are revolutionary. They're not revolutionary. They're just applied differently. Applied how? With urgency, with precision, with the understanding that every life matters. One afternoon, a severely injured dog was brought in after being hit by a truck. Other vets had said the case was hopeless. Emma examined the dog, then looked at the crying family. "We're going to try. I can't promise success, but I can promise we'll do everything possible." The surgery took 4 hours. Emma used every technique she'd learned in field hospitals, adapted for veterinary use. Tyler assisted, watching a master at work. The dog survived. Full recovery. The family was amazed. "Dr. Hayes, how did you save him?" "Because someone once taught me that you never give up as long as there's life." "Who taught you that?" "Every soldier I ever treated. They taught me that life is worth fighting for." That evening, as Emma cleaned up after the surgery, Tyler asked her about the future. "Dr. Hayes, any regrets about leaving the Army?" "None. This is exactly where I'm supposed to be." "Why?" "Because healing is healing. The mission continues." "What is the mission?" "To preserve life, to reduce suffering, to give hope where there was none." Emma looked around the clinic. Clean, organized, ready for tomorrow's patients. "Tyler, in the Army I saved soldiers so they could go home to their families. Here, I save family members so they can stay home with their soldiers." Family members. Pets are family. Every animal we save goes home to people who love them. Tyler understood. Emma hadn't changed missions. She had expanded it. "Dr. Hayes, what's next?" "Same as today. Same as yesterday. Someone will need help. We'll be here." That night, Emma made her final rounds through the clinic, checking on patients, ensuring everyone was comfortable, preparing for whatever tomorrow might bring. Staff Sergeant Hayes had found her final duty station, not a forward operating base, but a small-town veterinary clinic, not treating soldiers, but treating the animals that soldiers and their families loved. Same mission: preserve life, reduce suffering, bring everyone home safe. Different battlefield, same heart, eternal service. Now I ask you, have you ever met someone whose hands were born to heal? Someone who understood that compassion has no boundaries, that life is life, whether human or animal? Share their name in the comments. Tell us how they made a difference. At Silent Heroes Stories, we believe the most powerful healers often have the gentlest touch, not because they haven't seen violence, but because they've seen too much of it. If this story moved you, subscribe and share it. These healing heroes deserve recognition for choosing compassion over conflict, gentleness over glory. See you in the next story. And remember, your veterinarian, your doctor, the person who dedicates their life to healing, might just be the warrior who chose love over war and found their true calling in making others whole. Because healers don't retire from service, they just find new lives to save.